National Cabinet to hold twice-weekly meetings in an effort to fix the troubled vaccine rollout. Let's go live now to the Shadow Health Minister, Mark Butler. Mr Butler, thanks for your time. You've been critical of the government's rollout. Isn't it a good thing then that the Prime Minister is going to meet more regularly with the state and territory leaders?
Well, I have been critical, Kieran. I think everyone has been critical of a rollout that really had run off the rails. And one of the things I have been saying is that the first thing you need to do is admit you've got a problem. And I'm glad the Prime Minister has finally admitted that he has a problem. And he's also apparently picked up a couple of things that I and many others have been saying, which is we are going to need more state government involvement in this. State governments are the ones with the capability and the experience in mass healthcare delivery. They are well positioned to take up a significant part of the load of delivering vaccinations in mass vaccination centres, something which Scott Morrison had rejected for too long, frankly, and I'm glad to see that he's shifted position here. I think one of the disturbing elements of the rollout of this announcement this morning, though, was at least one paper carrying someone from the government saying this is about sharing the blame for the vaccine rollout going off the rails. If this is just a political management strategy, rather than a genuine desire to get this thing up and running again, to protect the health of Australians and to ensure that we have the best possible economic recovery, I think that would be a real pity.
My colleague Andrew Clennell quoted a state official in his report earlier that every health minister in the country is annoyed with the federal government at the lack of information they're receiving. Isn't the lack of information driven in large part by the lack of supplies, which to an extent was outside of the federal government's control?
Well, no, it wasn't outside the federal government's control. It's because the federal government made some, I think, very bad decisions last year. First of all, they were too late to the negotiating table. We know that Pfizer, for example, had secured deals with the United States and the United Kingdom, among others, in July. We didn't finalise our deal till November, which put us way back in the queue in terms of supply. The other thing we'd been saying many months ago, well into last year, is we need more deals. We need 5 or 6 deals. We need to negotiate a deal with Moderna, which is rolling out right through North America, right through Europe, starting in the UK to substitute for the gap that the AstraZeneca decision has left there, a range of other opportunities as well. So too late, too few. And I think we're now bearing the consequences of that. But we are where we are, so at least we've got to make the best of the situation that Scott Morrison has put us in. And that's why I think it is a good thing that the state governments will be brought more into the picture. It is going to mean, though, that they're going to have to repair some of these trust issues, because state governments and GPs have been rightly complaining about the lack of information, the lack of good levels of notice before doses arrive, and there frankly not being enough doses. Still, 3/4 of GP practices are only getting 50 doses per week. I was at a practice earlier this morning, a very large practice that could do many hundreds per week, at least 200 a day, a very large practice, only getting 50 doses a week. They're done in about half of a morning session with all of their weekly doses. So we need more information. We need those supplies that we do have flowing more quickly.
I spoke to the president of the Australian Academy of Science yesterday, and his argument is that we should just build the capacity for an mRNA plant in order to be able to manufacture a Pfizer-type vaccine, which is also, from the experts we've had on the program, is more nimble in dealing with new variants. Is that a good idea? Should we be building that capacity, or have CSL or another organisation have the capacity to manufacture mRNA jabs?
Absolutely, absolutely. This is state-of-the-art vaccine technology. It's technology that's rolling out right through Europe and North America, as I said. Pfizer is one example of it, but the other product is the Moderna product. For reasons I still don't understand, the government has refused to negotiate a deal with Moderna, which is a critically important product through those markets I've talked about. Importantly too, Moderna already has a booster vaccine that is going to trial. We are going to need booster shots probably to deal with the fact that this virus is mutating. Variants are spreading right around the world. At least one of them, the South African variant, that seems to be resistant to the current generation of vaccines. So having an mRNA manufacturing capability is really, really important. More than 12 months ago, the government recognised that. And yet still we've made no progress in relation to that whatsoever. Take Germany, for example. They built an mRNA manufacturing capability in only a few months, which gives them the obvious advantages in terms of product security and supply security.
The Health Minister said, as recently as yesterday, he said explicitly, if the advisors, if their top health advisors tell them you need to procure more different jabs, more jabs, they'll do it on every occasion. Aren't they simply listening to the advice?
Well, we don't know. We're not getting enough clear information about the reasons why the Moderna vaccine was not the subject of aggressive negotiation by the Australian government. I mean, there is too much of a sense that the Australian government, the Morrison government, was too late to the party, not pushing hard enough to get a deal quickly with all of these vaccine companies around the world, which is why we now have the supply problems that we have. You know, I've not heard a sound explanation about why Australia would not have access to the Moderna vaccine. You know, all of the countries to which we usually compare ourselves have access to this vaccine. It's highly effective, got a very high efficacy rate. And as you indicated, Kieran, that your experts, the experts you've been talking to, have indicated, this is a highly adaptable technology. We should have more mRNA vaccines to complement other vaccines that have been developed around the world.
Shadow Health Minister Mark Butler, appreciate your time.
Thank you, Kieran.